As I noted in my opening, State of Reform is about bridging between policymakers and industry leaders around critical topics. This kind of public-private coordination is exemplified by our bookended keynotes. We'll be closing the day with a state government representative to come and talk to us about the public policy making. But we're going to start off our day with Leanne Berge making some opening comments. Leanne is the CEO of the Community Health Plan of Washington, with a long track record of leading integrated delivery system organizations, managed care organizations, and many efforts in the healthcare improvement initiatives across the spectrum. Leanne, I'm going to go ahead and ask you to come forward, and then we'll get going on that.
It is a bright light. Okay. Good morning. I can't see anybody. Happy to be here this morning, and thank you, Kathleen, for that opening. And I am excited to be here this morning because it's exactly 7 years ago that I first came to the state of Washington, and I came from Massachusetts. And I was new to the state, and the first week that I was here, I came to the State of Reform. And coming from Massachusetts, I was very proud of the healthcare system there. We were #1 in everything, and it was the first state that had uninsured reduced to very low numbers. It was the model for the ACA. We had very high HEDIS scores, very top of NCQA rankings and so forth. So when I came to the state of Washington, it was like, what's it going to be like here? And at the State of Reform, I was so thrilled that all the same issues were being discussed, and not just discussed, but they were being implemented. And there was this very strong consensus across all of the healthcare sectors that Washington State was ahead of the game and was really focused on reforms and all of the key areas of improvement that I had experienced in Massachusetts. So I was just thrilled to be here, and I was so excited about the work that was happening in Washington State. Very specifically, the first week that I was here was when there was approval for the 1115 waiver with Medicaid, and that was the start of a lot of very important work on the Medicaid program associated with integrated managed care. And integrated care was really the focus of everything that I've always been doing in my career. The integration of behavioral health and physical health services is and was just key to ensuring that people's health needs were met and that people's outcomes would be improved. And so just coming in from the very start, I was very excited about the efforts that were happening within the state of Washington. It continued, and there's been just a lot of important work throughout the state relative to some of the most important initiatives relating to integration, relating to social needs and health-related social needs. And that has now been even more recognized with 2.0 of the waiver, the most recent waiver that was approved by CMS in the state of Washington. And that's recognizing the importance of the broader factors that impact people's health and well-being. And so I couldn't be more excited about the work that's happening in the state of Washington. Once again, the state is really just ahead of the curve. We've been focused on recognizing whole person care. We've been focused on understanding that health equity is really at the crux of all the work that we do, and that we have to be focused very intentionally on all of the factors that drive health and health outcomes. And it's not about silos. We're very much a state that has been working together in a cross-purpose understanding that the most important factors that impact health. We're all working together to improve the health outcomes. So what are the key areas of reforms that I think we've all been focused on and that there's truly a consensus about? I just want to enumerate them. Most importantly, from our perspective, advancing health equity and reducing and eliminating health disparities has to be the #1 focus. We are really only as strong as our weakest link, and if we are not focused on the areas that people have been historically seeing these gaps, we're just going to never be successful as a state in moving forward in our health and well-being of our communities. And so that's number one, is to recognize that there's disparities that exist because of historical reasons, because of racism, because of ageism, because of lack of communication among folks with different cultural needs, because of geographic reasons. There's so many specific historical reasons that we have to focus on those root causes if we're going to see health improvement. And that's number one in terms of the reform areas that we have to focus on. Thank you. And secondly, we really need to support patient-centered whole person care. And I think there's broad consensus of this as well. We have an approach to care that puts patients in the center. And that means it's the patients who determine what is needed for their best interest and their health. It's not a top-down, patronizing, historically perspective of how people's needs need to be met. Instead, it has to be based on what the patient or the client or the member sees as their needs, and how do we address those needs from their perspective. Recognizing that people's needs are very complex, that there's social, behavioral, physical, and so forth that connects with itself. And if that isn't addressed in that holistic manner, we're not going to see improvement in our health. Third, reduce fragmentation of care delivery. And this is something that we've been working towards historically, and it's still a problem, and we know it's a problem. But that's where it's really important to put all these pieces together, including shifting the incentives. The fourth most important reform is to shift incentives from volume to outcomes. And if we do that, we have a broader opportunity to really avoid that fragmented healthcare silos that have really been a detriment to people's health and well-being. So reducing fragmentation and shifting incentives go together very directly. Fifth, expand coverage and reduce the number of uninsured. None of the work that we do is possible if we don't have full universal coverage for individuals. And that's a big step that this state is taking in terms of improving access for immigrants and folks that are not currently covered. And we have to keep working on that. That's essential to the well-being of the state. If we don't have universal coverage, people will continue to have their care limited by emergency room use only, episodic care, and we won't have the ability to do the reforms that we know is needed for supporting the health of our state. And finally, improve affordability by reducing unnecessary utilization and by investing upfront in prevention and health. It all goes together. I think you all know that in this room. So those are the key areas that I think we do have a consensus on reform. This is something that has long been discussed in some form or another, but there is a consensus, and that's why we as a state have been successful in moving forward. Progress is slow. We know that, and it's been really handicapped, frankly, by the pandemic and by the fact that workforce shortages have really exacerbated a lot of the problems. All the post-pandemic needs have risen in terms of mental health needs and so forth, and yet the workforce has been more compromised. So we know that progress is slow, that there are forces beyond our control that limit progress, but together we have the opportunity to make a difference and to see progress return and to get an improvement in all of the areas that we're looking for. You know, I think that working together, we've made an impact on the health of our citizens and residents in the state of Washington. When we look at the work that we do together, it's really obvious, and we'll talk more about that when I have a chance to have a conversation. But I think it's that partnership, it's that collaboration that allows us to see improvement across all of the measures that are important to determining health and well-being. And it really is necessary in order to leverage the strengths and assets of each of the sectors of our communities. If we think of ourselves as working in our own organizations, we're not going to be successful unless we recognize our own limitations. Because each of us have strengths and we have limitations, and we have to connect with each other and find those assets that our partners have in order to be successful, in order to move forward. We have to focus on the vision of equitable health for all of our citizens, all of our residents. If we're not focused on that, we're just not going to succeed. And we have to share best practices, innovation, collective problem solving. That's what it's going to take to move forward. So when you look back on our progress over time, I think there's been a lot over time that is really something that we should be proud of. And very specifically, how are we doing as a state? Well, according to the Commonwealth Fund's annual State Health System Performance Scorecard, the one that just came out, Washington State is number 8. That's good, but it's not good enough, right? We really want to be number 1. We want to be number 1 in sports. We want to be number 1 in healthcare. We want to be number 1 in health outcomes. We want to be number 1 in health equity. That's really what matters more than anything else. And this scorecard was based on 58 measures of healthcare, including access, quality, use of services, costs, health disparities, reproductive care, and women's health and health outcomes. So it's a pretty good way of measuring success in the efforts that we're doing. I just want to say once more that collaboration and partnerships is really the most important part of the work that we're doing, and why this conference is so exciting and so important for us all to be participating and engaging in. I think it starts with the convening panels. We've seen that there's a great representation of folks from all across the healthcare sectors. And for every year, there's been really relevant topics. I've been here every year, and I think it's never been disappointing, because there's always topics that are relevant to the day and how we can work together. I appreciate the breadth of the speaker panels. There's people from all parts of the industry, all parts of the ecosystem, and that's what makes it worthwhile. And of course, the attendees. So thank you all for being here. I really appreciate everybody's participation and interest and engagement, and I'm looking forward to the day. So thank you very much.
So we want to dive in just a little bit deeper to some of your comments, Leanne. Really appreciate that. Not just the parts about the agenda, but about partnership. And so as people are sitting in the meetings today and the panels today, as you said, we've got a wide variety of speakers and voices in each of our panels. So I wanted you to talk about, maybe from the Community Health Network perspective, what makes for a successful partnership, particularly between providers and plans. When you're talking about integrated care, what are the elements of a successful partnership in that environment, and maybe what gets in the way of those successful partners?
Oh, I have my own microphone. How about that? Can people hear me? Yes. Yeah, thank you for that question. My whole career, I've been working on that intersection of the health plan, funding mechanism, and provider network. And one of the reasons I just love my job right now so much is that it's a really unique organization that is both a health plan and a network of community health centers. There's very few organizations like this in the country. And we have 21 community health centers that make up the network of Community Health Network of Washington. And they're our governing board for the health plan. And so there's a natural alignment of goals just because of the governance structure. But it's not something that we can just assume will continue in all of the work that we do. We really have to work hard to make sure that there's that alignment. And that alignment comes from, first of all, recognizing our common goals and recognizing that together we have the opportunity to do so much more than we would on our own. We build those goals into our contract relationships, and I think that's critical. You start with what are the basic principles that we all agree on? How do we want to get there? And then how do we align incentives so that we have that opportunity to work together without any friction? Now, there'll always be some opportunities where somebody thinks I could do better on my own on this particular area, that I'm making compromises, because that's what it's all about, right? It's like the difference between working as a country with the multiple states versus just working as an individual state. But we do see that if you have alignment of the goals, and that's really clear what we're trying to achieve, build those alignment into the financial arrangements, that's the recipe for success in terms of partnerships.
That's great, and what a good reminder, just because we have a shared goal, it doesn't necessarily mean that everything flows from that. We have to continue to shape it as we go, and I think that's really critical. In that vein, let's turn to the issue. I think you used the phrase ethical health, but health equity and achieving that. I think we all feel like we have that shared goal, but then it comes to the practicalities of that. So how do you think about talking either in contracts and other places? Where's the money going to come from to do this? Where do we need to add services, and how do we make that happen so that the goal is not just stated as a goal, but is it actually moved towards, progress towards?
Yes, advancing health equity it's really integral to who we are as an organization at Harvard Community Health Plan. It's really also something that I personally have cared about my whole life. But it is something that requires improving understanding and creating a culture across all of the individuals that are associated with the work. And it doesn't happen naturally, because I think for many people, they start out thinking, well, equity is for somebody else. I'm already getting what I want. You're going to have to take it away from me to give to them. I think that's the human psychological component that we have to fight against. And I think it comes from a lot of fear and a lot of ignorance, that people think that there's a limited pie and it's, scarce resources, and we have to, hold on to what is ours. And that's just a faulty way of thinking, because the reality is that we all benefit when everybody has an equal opportunity for good health and for a better life. And that's not always easy for people to see. And you have to educate people on what the current situation, the problems that occur because of inequities, and how it really does have impact on everyone when your neighbor is denied the same opportunity as you are, or it's your own family member oftentimes that are denied that opportunity. And we're really all connected. If we think about equity more broadly, we're all going to have disabilities at some point. We're all going to age. We're all going to have family members that might have be transgender or gay, or so it's not just the other guy. It's all of us that benefit when there's a more equitable world, frankly. This is a big subject for me to be trying to explain in this early morning, but I think that it does come down to education, improved understanding, and then if we're all on the same page of understanding what that end goal is, then we can work out the how do we get there.
I wanted to ask you one more question around, you described the interruption of the pandemic and progress being slow. How do you keep momentum? You've talked about these goals. How do you do this in your organization? How do you think about keeping momentum and keeping the stories real for people to remind them of why progress might be slow, but we have to keep going? Any tips for folks to think about today on that?
Yeah, I think we have to always remember that whatever our problem is at any point in time, there's a longer view. And I think that what gets in our way is when we get stuck in the present and we lose sight of our larger views and our vision and why we're all here. But I think the exciting thing about being in the healthcare business is that we're here for the right reasons almost across the board. We care about improving people's health and well-being. And so it's such an important goal, it's such an important vision, that we can get past the everyday problems by looking ahead and looking at what's possible and remembering why we're here, remembering the missions of our organization, working with, so many people get that inspiration by working with individuals on a daily basis. For others, it's more about changing the system, and that's a little bit more theoretical. But at the end of the day, the importance of our work can't be denied, and I think that's what gets us through the harder times. And if you look back historically, you get perspective, you realize that things go in cycles. There's always going to be setbacks, but at the end of the day, there's a long view, and there's opportunity to see that progress over time.
That's wonderful, and I think as we've come into this conference this year, we've been thinking about the fact that there's a gubernatorial election, and here in the state, that there's a lot of turn and other issues at the federal level. Sustainability is just key, and so keeping your eyes on that goal, I think, is critical. Another comment, and I don't know if you want to respond to it, so I won't make you if you don't want to, but one of the things that I've heard in a lot of places, including in conversations here, is that the pandemic was disruptive, but it also taught us what we can do. And I think there's a sense that we can either capture that momentum and that disruption, or we can go back to what we were doing before. And I think a lot of people hope we don't do that. I don't know if there's been such a seeking of returning to normalcy, where maybe that's not the best option. So I don't know if you have any comments on that. It's just
Yeah, no, I appreciate that perspective, because there's a phrase, a crisis is a terrible thing to waste. I completely agree with that. I think that's given us that added momentum and intentional work on health equity. The pandemic really showed in glaring data just how much the disparities were among our communities based on long-standing historical conditions, and not just in terms of specific health disparities, but much broader than that around social justice. And I think that it has been a very motivating force to make change that goes way beyond business as usual. So yes, I completely agree with you.
Thank you. Well, I think you've given us a lot to think about, both in terms of what we're looking for, but this idea of starting with the goals and the shared goals, but moving into the practicalities of how we execute, how we sustain, and how we make sure we move forward, even when progress can sometimes be slow. So really appreciate your comments today. We're going to go ahead in a few minutes and adjourn for our breakouts. I hope that you take those constructs that we've been talking about this morning into those conversations. Be on the lookout for the components that we need to all take as we dive into specific topics and specific initiatives as we go forward. Couple of breakout sessions. We'll return back here for lunch. And then some more breakout sessions. Again, I'm really excited to be kicking off our year here with you all today, and look forward to great conversations. I hope you find it hard to decide where to go now. That will be a successful marker for us. So thank you for that, and we'll see you back here for lunch. Leanne, thank you so much for coming.
It was my pleasure. Thank you.
Appreciate it.